Hi, my name is Carl Velasquez, and today we're going to be doing a short assessment of the abdomen. Okay, I have my patient here laying down already with her abdomen showing. What's your name?
Valeria,
Okay, Valeria. And what's your date of birth?
September 12, 1993.
Okay, and with the normal protocols, I would check her wristband and just verify the information. And now, to start off the assessment, first of all, you want to be on the right hand side of the abdomen area. Okay, and the first thing you're gonna do is assess the abdomen. Okay, you're gonna look. Okay, roughly you see everything is normal. You see her stomach's coming up slowly and then going down. And after that, what you're gonna do is typically you're gonna have a light, and then when you have the light, you're gonna have it facing you. Okay, and then you're gonna look. Okay, you're gonna see if there's any abnormal bumps, anything that seems out of the ordinary. All right, so the abdomen is split into four quadrants. Okay, you have the upper right quadrant, you have the lower right quadrant, then you have the upper left quadrant, and the lower left quadrant. All right, and in the upper right quadrant, that's where you're gonna have the liver. All right, and then on the upper left quadrant is where you're gonna have your spleen, which are two very important parts of our abdomen area. Now, with the lower right quadrant, that's where you're gonna have the kidney. The kidney is always gonna be lower than the left kidney due to the fact that it has to accommodate the liver. So to start off, I'm gonna go ahead and just visually see if her umbilicus is symmetrical. Okay, I can see that her skin is normal. There's no abnormal colorations or anything like that. I see that I don't see any redness in the umbilicus area. I don't see any rashes or anything like that, which is a normal thing. Now, to start out, what I'm gonna do is go ahead and palpate. So I'm gonna start with the upper right quadrant, and I'm gonna feel around, okay, around the coastal area of her ribs, and feel the actual liver, okay? And you want to do that roughly for about 5 seconds to see if you feel anything abnormal. And then I'm going to go ahead and walk, around and go down to the lower right quadrant, okay? And I'm going to go down to the pelvis area, okay? And then from there, kind of work around the area. Then jump over to the lower left quadrant, feel around, palpate the area, and then go up all the way to the left coastal area of the ribs. Okay, never be afraid to kind of get in there and feel for any abnormalities, especially if the patient is, whether the patient is skinny or whether the patient is obese. If the patient is obese, you're always going to want to kind of dig in there more. Don't be afraid to to get in there. And I mean, it shouldn't hurt the patient at all due to the fact that they have the excess fat. And if originally they're not feeling any symptoms, they're not feeling any pain in their stomach, then that's normal for you to do. Now, afterwards, you will want to go ahead and percuse. Okay, see if you feel anything. Try to get in there, especially the liver. Okay, go around it. And just work your way around. Everything seems normal, which is a great sign. Now, a very important thing to do is, even though the abdomen area is split into four quadrants, it also has a epigastric area. It has the umbilicus area and the pelvic area. So when you're doing your palpating, you're wanting to check all of those three major areas, especially, and also get in there, like I said before, get into the liver and get into the spleen area. And then what I would do with the patient is I'm gonna go ahead and move her to her right side, okay, and I'm gonna palpate especially with a rib area or the spleen is at, which is the spleen is usually between the 9th to 12th rib. Okay, get in there, feel for any abnormal bumps, anything that seems enlarged. Once again, everything seems normal. And then just to finish the assessment, I would ask if there was any pain. So were there any pains while I was doing the palpation?
No.
Okay. Did you perhaps feel anything abnormal?
No, it's hurt a little.
Okay. Sometimes, especially as a beginner, I may have done it a little bit too hard. But, I mean, I didn't feel anything abnormal, anything out of the ordinary. Her breathing is normal. Her, her bowel movements seem normal. Unfortunately, I don't have a stethoscope with me right now at the moment. But, I mean, just doing the quick assessment, everything seemed normal with the patient. So that concludes my assessment. Thank you.